confused. It's like a piece of string that has knots everywhere and you don't know how to untangle it because it's just a mess.
That's right. And so much money is lost in the mess and nobody can untangle it, which means that nobody can get out of that you can't get out of the mess, right? So the only way to get out of the mess is to disassemble it completely. And so we look at that triangle, and if you just put a big or lots of dollar signs in there, this is where so much money is going up to the top of the triangle to the payer to ask permission to send money, to send data, to respond to the payer's request, to do, prior authorizations, all of that, which does nothing to get to get care from the doctor to the patient.
My understanding is that some clinics spend, 40, 50, 60% of their time just arguing with the insurance companies. It's astronomical amount of time.
Right. So right. And no patient really sees that. And so they don't really understand the triangle as well as the doctors understand the triangle.
That's why there's so much turmoil that's behind the scenes. The patients are just upset because they have to pay all this. They don't understand why. Doctors are upset because they can't provide care and they're having to spend too much time. Everybody's upset because nobody gets the full picture, and the full picture is a mess. It would be nice to just break it down and simplify it, because it shouldn't be this complicated.
Well, when we get to the 3 parallel lines, several things will have happened. One is you have a direct contractual relationship with your doctor, a direct contractual relationship with your hospital, and a direct contractual relationship with the insurer. And the 3 do not intersect, except that the hospital will come into the doctor will come into the hospital, right? And the insurer will pay the patient, but it will not be this tangle. It will be all of these accountable relationships. But the other thing that will have happened is that there won't be managed care anymore. There won't be managed care because there won't be networks, because doctors will not have signed the contracts with the insurers.
They start to free up the doctors to do the job that they were trained to do and get the people who are not trained to do medical care out of that business.
And all of the money with it.
And if customers now have to pay directly, then doctors will still be accountable for making sure their services are affordable, but it's to the patients. It's kind of like eye surgery, the LASIK eye surgery, how that was just a competitive market and how it really came down to price and it's high in quality.
Right. As soon as you would take something like LASIK and you would decide to make it a part of the covered of your coverage and not be direct, it would just skyrocket in cost. Skyrocket.
Yeah, it'd probably be $10,000 instead of $600 per eye. Honestly.
Yep, that's right. And I will say, when it comes to prices, see, people are so afraid of the prices, and this is not where we should be. We should bring healthcare back to non-scary, right? Where you can actually afford it. So I was talking to somebody who had a bill of $27,000 from the hospital. In that bill was an emergency room visit, and then basically 7 days with an IV. Or 5 days with an IV, a week. I didn't ask exactly how many days. So a week with an IV. And so $27,000. But when she looked at the bill from the HMO, it was paid in full at $10,000. And I said to her, so let's just imagine that hospital didn't have to follow 132,000 plus regulations for Medicare, or 20,000 plus regulations from Obamacare, or a whole bunch of different managed care contracts, and all the billers and the coders and the lawyers and the managers and the data reporters that have to do with all of this. Now, how low could the hospital bill have been? $4,000?
Well, yeah. I mean, but what's this 27 if they're paying 10?
The 27 is the charge. And then there's the negotiated rate with the...
And see, so they end up paying 10. The actual, what they ended up charging was 27. So if you're non-insured, you're paying 27.
Unless you negotiate it as well, which hospitals will often do.
But you know who won't? Is the pharmaceutical companies when you're buying something from a pharmacist. When you can get a drug for like $15, but if you're not insured, it's going to cost you $250.
Yes, that's right.
And you can't negotiate.
That's right. That's right. But it's hard. The reason why the drug prices are so high is, one, because of the FDA and how long they take to do things, right? I've heard figures from 12 years and $1 billion. That's how much it takes to get one approved drug out. But I've heard figures even higher than that, right?
Yeah, but the issue, so there's a lot of cost behind that, and that's a whole nother can of worms.
Yeah.
But if you're insured, you might pay $15. But if you do not have insurance, it could be $250. I mean, there's a huge swing between insured and non-insured because they negotiate a much lower rate. So people without insurance really have issues.
Yes, when it comes to pharmaceuticals. But one of the reasons that the pharmaceuticals can be that high, I think, is because of third-party payment, right? So when third-party payment is such a piece of what happens, and when there's lessened competition, because that's, with the EpiPens, the whole deal.
Yes.
EpiPens, right? $600 for a twin pack that goes away and expires in a year. But
it was like $100 or something, right? And they jacked it by 6 times.
Yes, it was actually less than $100. And the medication itself that's in there, epinephrine, really only costs about $1. Yeah. Right. And so you could get a doctor to give you 2 syringes and an epinephrine a container, and you could carry them with you.
And what could they? Yes. And so now is that part of the wedge? I mean, is that kind of how you're all setting up going?
So a doctor who's in the wedge, who is really conscious of prices, and they know that their patients are also conscious of prices, the patients would be asking, so how can we do this? I don't want to pay $600 for an EpiPen. Is there not another way? We have had doctors who are on my email list, and they have been talking about what they would do. This is part of what they said they would do. Well, just give them an ampule of epinephrine, and we give them, 2 syringes, and they'd be on their way after, probably cost them $10, and that'd be it, right? So as soon as you start with somebody who's not thinking in an insurance coverage mindset, the patients will start asking the question, isn't there another way, doctor? And not only that, but the doctors who become truly the advocates of their patients, these are their patients. They're not just somebody who's coming in. You'll see the same doctor. You'll have a relationship. They'll be looking across the table at you, the patient, and going, I care about this person. Why would I want to make them buy something for $600 every year? There's a really easy way to do this. They start actually.
Well, what about pharmacists, though? There are pharmacists that can custom make things as well. And I just had a pharmacist on last week who is custom making drugs because the mass producers aren't making like pain medications, and that they're not making like creams that can just target one area, or they're not making certain drugs that they used to make before because they look for just fulfilling what the masses need. And so many of these drugs, people fall out of that mass thing. It gets back to my whole everything's a drive-by or drive-through restaurant. And so this pharmacy is creating custom drugs, all legal, and making it affordable, and also helping people get off of, being addicted to drug medications. Because we have over 100 million people addicted to drug meds in this country. And so there's solutions coming from pharmacists. So do you have pharmacists in the wedge?
We do not yet have pharmacists in the wedge. So I think that is something that could certainly come, but it's impossible, of course, to turn this entire system around, on a dime.
Well, I know. I'm just thinking just right now. I mean, someone like it's Shalom Pharmacy, but someone like that could be connected to all these doctors and really help them out.
Right. So they're doing compounding, and there aren't a whole lot of pharmacies doing compounding. But when you need something special, it's a wonderful thing to have a compounding pharmacy available, because that's what they can do. I mean,
and he's doing it at affordable prices, and then he works with the doctor to help figure out how to unwind the person who's addicted to pain meds, or figure out a way to get them. He's doing more service than a normal pharmacist because they're working to keep them from being addicted to drugs in the first place, and they're doing all these things. And so he has a lot of really good relationships with doctors to try to solve some of these issues.
Well, that's wonderful. That's great. I just see a future of freedom. We're starting with this map of freedom, but the whole idea is to drive to a future of freedom for healthcare. And it's just a matter of, we've started the journey. And we are so thrilled with all the practices that have come online. And we know that there's so many more practices that can be part of our map. And then, of course, our hope is that all those doctors that are looking to, they look at everything that they're doing, the bureaucracy, and they're just pained. They're pained by it, right? And that we could start to peel them off, that they would realize that, oh, yes, patients could actually find me. There's a place, if I decide to, get out of this big group, or if I decide to go insurance free, patients could actually find me, and I will offer them affordable prices, and I will not have to deal with all this bureaucracy. I won't have to deal with the government. I won't have to deal with the health plans. I'll be free to be the doctor that I always wanted to be. And we will start to peel them off into the wedge. And so we have on the wedge, we have a share tab as a way for patients to hand something to their doctors. Because we believe that patients will be able to reach their doctors in ways that our organization, Citizens Council for Health Freedom, that we cannot. And so they can reach their doctors, and they can plant the seed of freedom in their brain. And one of the cool things that happened is we have a card. We have a card that patients can use to hand to their doctor. That's just a regular card. If you happen to come to one of our events, we have the cards, but anybody can do this on the share tab. Anyway, so I took this card to an orthopedist that I happened to be seeing for a broken toe, and I gave it to her, and she read it, and without looking up, she said, "Oh, this is great." And then when she was all done with reading those 8 principles of the wedge, she looked up at me and she said, "You mean all I'd have to do is my job?" She said, "This
Yes.
is wonderful, right?"
Well, now
this is every doctor.
So now can they make more money and charge patients less without all the bureaucracy in their way?
So doctors will find several things when they first decide to drop all of their contracts and the government. They will find that it will take them a while to build up their patient base. Some of their patients, probably a majority of their patients, will leave, but some of them will stay. And then they'll start to gain more and more and more patients. And then they will limit the number of patients that they will have. Oftentimes, depending on who they are, they might limit it, particularly in the direct primary care. They'll limit like to 400 or 600 patients a year that they will give full service care to. But I was reading about a specialty practice who dropped all of their insurance contracts, and it was 4 years after they had done that. And they said that they were making 60% more than when they were when they dropped their last contract. So while they were still having contracts, they were making 60% less than they were 4 years later after they dropped all the contracts.
And were their patients paying less, significantly less at the same time?
Yes, because they don't have to do all those costs related to the bureaucracy of managed care and government. In addition, they don't have to do the electronic health record. So you may or may not realize that the electronic health record is mandated by the government if you want to be fully paid by Medicare. Otherwise, there's a reduction of 6 to 9% from every Medicare reimbursement. And so just last week, I believe it was, a report came out and said that the electronic health record, which isn't very user-friendly even for the doctors, and it has all sorts of safety problems to it, but the electronic health record is costing practices more than $32,500 per doctor per year.
Oh, geez.
And so it's not only a pain for doctors to use, and they often will complain about how many clicks it takes. I have this one quote from a doctor that essentially says, if you want to give aspirin to someone, it's 8 clicks. If you want to give extra strength aspirin, it's 16.
Unfortunately, we dropped the connection and we lost about 3 minutes of recording time here. They're having a lot of construction on our site. So I'm just rejoining the interview and reconnecting it, and it's just phenomenal information. So I wanted to make sure we brought it back, even though it might not make sense of why we stopped suddenly and then started talking about something else suddenly, but that is why. So we're going to rejoin the interview now.
To listen to you rather than type. And then you have a third person who's in the room listening to everything that you say and writing in every word that you say. Click, 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 right? And so it becomes not a safe environment. And that is also not the way to do medicine. It's supposed to be a confidential patient-doctor relationship for a reason.